Hi, this brief presentation will review the documentation needed for patients' room to the behavioral healthcare zone. Remember that these are still ED patients, so you can continue to use the ED documentation and standards, unless ordered otherwise. We have added a provider order set and new enhancements to our current behavioral health navigator. Additional sections have been added for RN, PSCs, and techs. So let's review each of the sections in more detail. Let's start with the Behavioral Healthcare Zone Wellness Plan of Care. This is a customized care that can be provided in a behavioral healthcare zone. Patients in this area will benefit from a more pleasant environment that incorporates simulated natural light, a structured day, and group activities. As these patients have been medically clear, vital signs are defaulted to every 8 hours while awake. The direct observation order has been added if that patient may need a one-on-one while in this space. All diet orders will be on safe trays. The expectation is that all patients will eat together in the milieu space. The PSC in the zone will be responsible for assisting with menu ordering for all meals. We have modified the menu primarily based on finger foods for patients to choose from every day. The most frequently asked labs and diagnostic tests from inpatient psychiatric facilities have been incorporated into this order set. They may be ordered, if not completed while in the main ED, once a facility has been identified. Inpatient facilities may request a COVID test within 24 to 48 hours of transfer. If labs are ordered in this space, follow the reliable method for lab collection in the ED behavioral healthcare zone. Also, under the order set, we have defaulted the consult orders for those services that will be active in the care of the patient in the behavioral healthcare zone. The next section to review is the Behavioral Healthcare Zone Navigator. Rather than create an entirely new section in EPIC, as these patients are still ED patients, we have worked within the current Behavioral Healthcare Navigator. Additional sections have been added to both RN and techs or PSCs. We have also added a standardized validated violence checklist, so let's review that in more detail. The first section is our current ED admission checklist. While there are some tasks that may not be necessary, utilizing the same checklist allows both the EDRN as well as the ED Behavioral Healthcare Zone RN to document in the EMR. The next section is the family information. These items are extremely important in the behavioral healthcare zone. We want our patients to have a sense of safety and normalcy in this area. Also, establishing clear expectations will be critical for identifying boundaries of what can and cannot be done in this space. Designated caregivers. Parents will not be able to spend the night in the behavioral healthcare zone. The staff must get accurate contact information for the 2 designated caregivers that will be allowed in the space. Both visitors must also go through the badging process that every admitted patient caregiver goes through as well. When you click on the contact information, the free text line drops down for you to enter the phone numbers. Patient home in medications. While there will be a PHCZ in the behavioral healthcare zone, it has a limited supply of medications. Additional medications may be able to be obtained from the Zone A PHCZ as a secondary source. The only situation when we should be using the patient's own medication is if the patient comes in on a medication from home that we do not have on formulary. In this case, we still need an order and we must verify with pharmacy prior to administration. The Process Violence checklist has been built into the RN Navigator. If you want to see what each tab means, you can click Show Row Information. As the Process Violence checklist is completed, the score automatically tallies. Ideally, we could avoid escalation by identifying a patient's triggers as well as calming factors early on with the completion of the behavioral risk assessment. This may be an instance where a one-on-one sitter could be implemented in the behavioral healthcare zone as well. If a patient continues to escalate, becomes aggressive, or requires a birth, consideration should be given to have the patient transferred back to the main ED. As part of the transfer process, the PSC in the behavioral healthcare zone is responsible for orienting the patient and caregiver to the space. The RN has the ability to document this orientation as well. And that's it. Any questions, please feel free to reach out. The updates to the Behavioral Health Navigator are currently available in the EPIC practice environment for you to review. They will be live in EPIC on July 11th. And thank you so much.